Question 1. A nurse is caring for a patient with a recent thyroidectomy. Which findings should be reported to the provider immediately? A. Hoarseness when speaking. B. Difficulty swallowing water. C. Tingling around the mouth. D. Mild neck discomfort. Answer. C. Tingling around the mouth. Question 2. A patient with Addison's disease is admitted with low blood pressure and confusion. What is the nurse's first action? A. Notify the rapid response team. B. Administer prescribed oral corticosteroids. C. Check serum sodium and potassium levels. D. Place the patient in a supine position with legs elevated. Answer. D. Place the patient in a supine position with legs elevated. Question 3. The nurse is assigning care for a patient with uncontrolled type 1 diabetes. Which task is appropriate to delegate to an experienced UAP? A. Teaching the patient how to administer insulin. B. Checking the patient's blood glucose before meals. C. Interpreting the results of glucose monitoring. D. Evaluating the patient's understanding of foot care. Answer. B. Checking the patient's blood glucose before meals. Question 4. A client with syndrome of inappropriate antidiuretic hormone, SIAD, has developed confusion. What is the priority nursing action? A. Increase fluid intake. B. Administer a loop diuretic. C. Implement seizure precautions. D. Provide a high-sodium diet. Answer. C. Implement seizure precautions. Question 5. Which patient would the nurse assess first? A. A client with Cushing syndrome who has bruising on the arms. B. A client with hyperthyroidism who is agitated and has a temperature of 103 degrees Fahrenheit. C. A client with hypothyroidism who reports fatigue and cold intolerance. D. A client with diabetes insipidus who reports thirst. Answer. B. A client with hyperthyroidism who is agitated and has a temperature of 103 degrees Fahrenheit. Question 6. A patient with Graves' disease is receiving radioactive iodine therapy. What instruction is most important to reinforce? A. You can resume contact with children immediately. B. Limit close contact with others for several days. C. You must take iodine supplements daily. D. Start thyroid hormone replacement right away. Answer. B. Limit close contact with others for several days. Question 7. Which of the following findings in a client with hyperparathyroidism requires the most immediate action? A. Serum calcium level of 11.2 milligrams per deciliter. B. Muscle weakness and fatigue. C. Positive Chvostek sign. D. New onset of flank pain and hematuria. Answer. D. New onset of flank pain and hematuria. Question 8. The nurse is caring for a post-op patient after adrenalectomy. Which assessment requires priority attention? A. Blood glucose of 130 milligrams per deciliter. B. Serum potassium of 5.6 milliequivalent/L. C. Blood pressure of 88/50 millimeter of mercury. D. Temperature of 99.5 degrees Fahrenheit. Answer. C. Blood pressure of 88/50 millimeter of mercury. Question 9. A patient with diabetes mellitus reports blurred vision and frequent urination. What is the nurse's next best action? A. Encourage increased fluid intake. B. Recheck the patient's blood glucose level. C. Contact the healthcare provider. D. Instruct the patient to rest and monitor symptoms. Answer. B. Recheck the patient's blood glucose level. Question 10. A nurse is preparing to administer morning insulin to a diabetic patient. What is the most critical step? A. Confirm the insulin vial is unopened. B. Assess the patient's last meal. C. Double-check the dosage with another nurse. D. Ensure the insulin is refrigerated. Answer. C. Double-check the dosage with another nurse. Question 11. Which task is appropriate for the nurse to assign to a licensed practical nurse, LPN? A. Initial teaching for a patient with new hypothyroidism diagnosis. B. Administering subcutaneous insulin. C. Monitoring blood glucose trends. D. Adjusting insulin dosage based on sliding scale. Answer. B. Administering subcutaneous insulin. Question 12. A client with long-term corticosteroid therapy is scheduled for surgery. What pre-op concerns should the nurse prioritize? A. Hypertension risk. B. Infection susceptibility. C. Electrolyte imbalance. D. Poor wound healing. Answer. B. Infection susceptibility. Question 13. The nurse receives report on 4 patients. Who should the nurse assess first? A. A patient with diabetes and a blood glucose of 72 milligrams per deciliter. B. A patient with Cushing's disease, reporting fatigue. C. A patient with diabetes insipidus who has dry mucous membranes. D. A patient with hypothyroidism who is constipated. Answer. C. A patient with diabetes insipidus who has dry mucous membranes. Question 14. Which finding in a patient with hypothyroidism indicates the need for immediate intervention? A. Bradycardia. B. Cold intolerance. C. Puffy face. D. Drowsiness progressing to lethargy. Answer. D. Drowsiness progressing to lethargy. Question 15. What is the priority teaching for a patient discharged on levothyroxine? A. Take with meals to prevent stomach upset. B. Avoid all dairy products. C. Take at the same time each morning on an empty stomach. D. Report weight gain as a sign of overdose. Answer. C. Take at the same time each morning on an empty stomach. Question 16. A nurse is educating a diabetic client about foot care. Which statement by the client shows a need for further teaching? A. I should check my feet every day. B. I'll apply lotion between my toes to prevent cracking. C. I will wear cotton socks to keep my feet dry. D. I will never walk barefoot even at home. Answer. B. I'll apply lotion between my toes to prevent cracking. Question 17. A nurse caring for a patient with pheochromocytoma would expect which priority intervention? A. Encourage oral fluid intake. B. Monitor for hypotension. C. Avoid palpating the abdomen. D. Administer potassium supplements. Answer. C. Avoid palpating the abdomen. Question 18. Which assessment finding would indicate a complication in a patient with diabetes taking metformin? A. Mild nausea after meals. B. Frequent urination. C. Muscle pain and shortness of breath. D. Headache in the afternoon. Answer. C. Muscle pain and shortness of breath. Question 19. A diabetic patient reports drinking large amounts of water and still feeling thirsty. Which complication is most likely? A. Hypoglycemia. B. Hyperglycemia. C. Metabolic alkalosis. D. Thyroid storm. Answer. B. Hyperglycemia. Question 20. A nurse is reviewing lab results for a client with suspected primary hyperaldosteronism. Which result supports the diagnosis? A. Serum sodium 148 milliequivalent/L. B. Serum potassium 3.1 milliequivalent/L. C. Blood glucose 98 milligrams per deciliter. D. Serum calcium 9.2 milligrams per deciliter. Answer. B. Serum potassium 3.1 milliequivalent/L. Question 21. A patient receiving desmopressin for diabetes insipidus reports a headache and drowsiness. What is the nurse's priority action? A. Check the patient's blood glucose. B. Administer a dose of acetaminophen. C. Assess the patient's sodium level. D. Withhold the next dose of desmopressin. Answer: C. Assess the patient's sodium level. Question 22. Which symptom in a patient with acromegaly should prompt the nurse to notify the provider immediately? A. Enlarged hands and feet. B. Jaw protrusion. C. Visual disturbances. D. Deepened voice. Answer: C. Visual disturbances. Question 23. A nurse is caring for a patient with diabetic ketoacidosis, DKA. Which order should be implemented first? A. Administer regular insulin for. B. Infuse 0.9% normal saline bolus. C. Start potassium replacement. D. Obtain arterial blood gases. Answer: B. Infuse 0.9% normal saline bolus. Question 24. A patient with a pituitary tumor is scheduled for a transsphenoidal hypophysectomy. Which preoperative teaching is essential? A. You will need to remain flat for 24 hours. B. You must avoid coughing or sneezing post-op. C. You'll receive oral corticosteroids after surgery. D. You'll need oxygen via nasal cannula continuously. Answer: B. You must avoid coughing or sneezing post-op. Question 25. A diabetic patient is found confused and diaphoretic. What is the nurse's first action? A. Call the rapid response team. B. Check the patient's blood glucose level. C. Administer for insulin. D. Notify the provider. Answer: B. Check the patient's blood glucose level. Question 26. Which patient should the nurse see first during morning rounds? A. A patient with Addison's disease reporting weakness. B. A patient with diabetes reporting hunger and shakiness. C. A patient with hypothyroidism complaining of constipation. D. A patient with SIAD who gained 2 pounds overnight. Answer: B. A patient with diabetes reporting hunger and shakiness. Question 27. What is the most appropriate nursing diagnosis for a client with hyperthyroidism experiencing weight loss and restlessness? A. Risk for infection. B. Impaired comfort. C. Disturbed sensory perception. D. Imbalanced nutrition, less than body requirements. Answer: D. Imbalanced nutrition, less than body requirements. Question 28. Which action by the nurse ensures safe administration of insulin via insulin pen? A. Shake the pen vigorously before use. B. Hold the pen in place for 10 seconds after injection. C. Prime the needle after the injection. D. Store the pen in the freezer between uses. Answer: B. Hold the pen in place for 10 seconds after injection. Question 29. A patient with hyperthyroidism is started on propylthiouracil PTU. Which instruction is most important? A. Report fever or sore throat immediately. B. Expect to gain weight while on this medication. C. You may experience temporary vision changes. D. Take the medication on an empty stomach. Answer: A. Report fever or sore throat immediately. Question 30. A nurse is reviewing labs for a patient with suspected hypoparathyroidism. Which finding supports the diagnosis? A. Increased serum calcium. B. Decreased phosphate. C. Positive Trousseau's sign. D. Elevated magnesium. Answer: C. Positive Trousseau's sign. Question 31. A nurse is assessing a patient with Cushing syndrome. Which finding is the highest priority? A. Purple striae on the abdomen. B. Moon face appearance. C. Blood glucose of 210 milligrams per deciliter. D. Crackles in the lungs bilaterally. Answer: D. Crackles in the lungs bilaterally. Question 32. Which intervention is appropriate to delegate to an unlicensed assistive personnel, UAP, for a diabetic patient? A. Teaching the signs of hypoglycemia. B. Administering subcutaneous insulin. C. Assisting with foot hygiene and inspection. D. Adjusting insulin according to sliding scale. Answer: C. Assisting with foot hygiene and inspection. Question 33. A nurse is caring for a patient with suspected myxedema coma. What is the highest priority intervention? A. Administer levothyroxine 4. B. Provide a warm blanket. C. Insert a Foley catheter. D. Elevate the head of the bed. Answer: A. Administer levothyroxine 4. Question 34. Which lab result in a patient with DKA should the nurse report to the provider immediately? A. Blood glucose of 470 milligrams per deciliter. B. Serum potassium of 2.9 milliequivalent/L. C. Bicarbonate level of 15 milliequivalent/L. D. Serum sodium of 133 milliequivalent/L. Answer: B. Serum potassium of 2.9 milliequivalent/L. Question 35. Which meal selection indicates a diabetic patient understands dietary teaching? A. Grilled chicken sandwich, fruit juice, and chips. B. Baked salmon, brown rice, steamed broccoli. C. Pancakes with syrup and sausage. D. White rice with fried tofu and sweet tea. Answer: B. Baked salmon, brown rice, steamed broccoli. Question 36. A nurse suspects thyroid storm in a patient. What is the nurse's first action? A. Administer acetaminophen for fever. B. Monitor for seizures. C. Reduce environmental stimulation. D. Prepare for tracheostomy. Answer: C. Reduce environmental stimulation. Question 37. What is the priority nursing action for a patient admitted with hyponatremia due to SIADH? A. Monitor deep tendon reflexes. B. Administer 3% saline 4. C. Keep patient NPO. D. Provide salt tablets. Answer: B. Administer 3% saline 4. Question 38. Which assessment finding in a patient receiving insulin therapy requires immediate intervention? A. Diaphoresis and tremors. B. Blood glucose of 130 milligrams per deciliter. C. Hunger after eating. D. Reports of nausea. Answer: A. Diaphoresis and tremors. Question 39. Which endocrine disorder poses the highest risk for impaired wound healing? A. Diabetes mellitus. B. Hyperthyroidism. C. Addison's disease. D. Hypoparathyroidism. Answer: A. Diabetes mellitus. Question 40. A nurse is caring for a patient receiving corticosteroids. Which instruction is most critical to prevent complications? A. Take the medication at bedtime. B. Avoid abrupt discontinuation of the medication. C. You can reduce the dose when symptoms improve. D. Double the dose if you miss one. Answer: B. Avoid abrupt discontinuation of the medication. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.